Many older adults take multiple medications to treat chronic illnesses. Medical professionals might also prescribe medications to aging adults to prevent certain illnesses. On this episode of Aging Insights, we'll discuss why it's vital to manage your meds safely and tell you about programs that might help you pay less for your prescriptions. Welcome to Aging Insights. I'm Dr. Cathy Rowe, Executive Director of New Jersey Advocates for Aging Well. Joining us on today's show are three pharmacists, Dr. Mary Bridgeman, Dr. Christine Dima-Kalungan, and Dr. Jessica Bente. Can each of you please tell us about yourself?
Sure. Hi, I'm Mary Bridgeman. I'm a clinical professor at the School of Pharmacy at Rutgers University. I'm an internal medicine clinical pharmacist at Robert Wood Johnson University Hospital in New Brunswick.
Thank you. And Christine?
Hi, I'm Christine Dima-Kalungan. I'm also a clinical assistant professor at the Rutgers School of Pharmacy, and I'm also an ambulatory care pharmacist at the Center for Comprehensive Care in Jersey City Medical Center.
And Jess?
Hi, my name is Jess Bente, and I'm the Geriatric Clinical Pharmacist Specialist at St. Barnabas Medical Center in Livingston, New Jersey. I'm also the Residency Program Director for our PGY2 and Geriatric Pharmacy.
Thank you for joining us today. So my first question is, medications have come a long way, even replacing the need for surgery in some cases or offering increased quality of life. Can you talk about the changes and growth of prescription drugs in the last 20 years? We'll start with you.
Absolutely. I think really, if I reflect back on the past 20 years, there's been a lot of excitement with regards to drug developments and medicine in general.
Mm-hmm.
We know each year the FDA has approved somewhere along the realm of 50 different or new medications. And we've also seen our clinical evidence with regards to medication outcomes really improve. The United States Food and Drug Administration, the authority responsible for approval of new medications, has really continued to set the bar high with regards to outcomes of some of our medication studies with regards to benefit. So I think in terms of new medications and the treatment of a multitude of conditions, from diabetes to cholesterol and myriad conditions in between, we've really seen unbelievable advances in our science and in our medical understanding.
That's good to hear.
Yeah, I think to add to Mary's point, my patient population that I work with is an HIV Hep C patient population, and there have been a lot of advancements in terms of drug development in that patient population where people are being treated for HIV, being undetectable, and living longer lives. So if we want to talk about an aging population, that's a pretty prevalent aging population today. So I would definitely echo Mary's sentiments.
Right.
And I think also, too, the emergence of different dosage forms for medications has come a long way. You know, when medicines were first released, we always just thought, oh, you take a pill for this and that's it. Now things are in inhaled versions, topical versions, rectal versions. So we don't necessarily have to rely on people's ability to swallow, which is definitely more concerning in an older adult population. So
True.
A lot of my patients, being creative with how we deliver medicine, which has been great for those advancements as well.
Thank you. So we all see loads of ads on TV for pharmaceutical and medications. How do you know when to ask your doctor about a potential new drug for you, or is it better to wait for the doctor to bring it up? What do you recommend?
Well, I think it can be really overwhelming when you see so many advertisements on television, on the internet, and you don't really know where to get that information from. It never hurts to talk to your doctor about a new medication. I think it can only help you. And I personally believe that patients should be their own advocate, especially in our setting where it's an ambulatory care setting where patients are able to tell their stories, they're able to walk, talk. They should be their own advocates to what they're being treated for. And it never hurts to ask a question because that can lead to a conversation with your doctor.
I think it's a really important point because, certainly there's a lot of information and misinformation that we can come across out there. And I think whenever someone's got a question or something to do with their medication, it's a great opportunity not only to reach out to your prescriber or physician, but pharmacist also. If you see something that, you're curious about, certainly not sharing other medications that have been prescribed for others. If something works for a friend or a colleague, it doesn't necessarily mean it's right for you. But I think having that conversation with your provider or pharmacist is a really important strategy to be able to dispel what's good versus bad information and determine if it's right for you.
But don't try it out on your own.
Nope.
Okay. So as people have new or changes in their prescription medications, What are some of the ways they can be safe in keeping track of them? Because sometimes it's a lot to handle and it's a lot to keep track of.
Yeah, so definitely starting with what Christine said before about learning about new medications, it's really important to be your own advocate as a patient. So what I recommend for my patients is to keep a medication list. So a medication list, something like this, we always want to make sure that it has the medication, the dose, how often are we taking it, and also if you know why you're taking it and if you take it at a certain time of day. It's important to do that for all of your medications, keep it up to date, and also include anything that you're taking over the counter and also vitamins and supplements. What I find a lot of my patients do is they don't think that taking a calcium supplement or taking a vitamin D supplement is important, so they don't tell me that they're taking those things. But sometimes certain supplements or vitamins can interact with medications. So it's really important for us to know, whether it's pharmacist or a physician or both really, everything that you're taking, whether it's prescription or not, so that we know that you're being safe. And another way to make sure that you're keeping track of that you're taking them is using something like a pill box. So if you're taking medications once a day, having a handy once a day pill box, something like this is nice because, as you go through, for example, today's Tuesday, I know I took Tuesday's meds because it's open and it's empty. Right? As opposed to some of the other ones that are still filled, I know I didn't take them yet.
Right.
Same thing if you're using a multiple day pill box. So this has different times of day because sometimes people are taking things that are morning and bedtime or morning, noon, and bedtime and things like that. And what's really great too is something like this is that one can pop out. So if I'm leaving for the day, I could just take this instead of having to bring around my whole pill box.
And where can people get that?
You can really get it at any type of pharmacy, your local CVS, Walgreens, a Walmart, really any supermarket will usually have, and then just ask your pharmacist because they'll be able to point you to the right pill box.
Okay, thanks. And then what should people do with medications, prescription or over the counter, if they're expired or they don't need it anymore? What do they do with them?
Sure, absolutely. I think it's an important point that folks go through their medicine cabinets or wherever they're storing their medications at least annually, just to kind of clean house and dispose of medications that are expired or not needed anymore. And this is a common question I think we all receive as pharmacists. I'm a huge advocate for medication take-back programs that are offered by the local community. Right. So that's usually my go-to starting point to determine, when can you return things. That's really the safest way to dispose of things accordingly. Besides that, I want to point out that the Food and Drug Administration actually has a list of medications that are safe to be flushed down the toilet if appropriate. Usually these are medications that are used in the management of pain. And there's a very short list of medications that can be flushed down the toilet anymore because we're concerned about the environmental impact of our expired medications. So prescription take-back programs or medication take-back programs from the community is one. A short list of medications that can be disposed of in the toilet, two. The third strategy is really to remove any identifying information from the medication vial, the prescription vial, cross it out, smash up those pills, mix it with kitty litter, coffee grinds, or something unpalatable, seal that up, and dispose of in the regular trash. But I think it's certainly important to keep an eye on the expiration date or the use-by date for your medications because we really can't guarantee product stability or potency beyond that point in time. And there is certainly a potential for harm. So I think it's a great idea to go through that medication cabinet, again, at least annually, and dispose of those things accordingly.
So what should people do if they're prescribed a medication and it's cost prohibitive? They just can't afford it or their insurance doesn't cover it. What are options for people who are in that situation?
I run into that all the time, Cathy, especially with the patient population that we help take care of, especially with specialty medications. But even with the new medications that have come out for diabetes, for cholesterol, there are manufacturer coupons that patients can get online or through their pharmacy, even through their doctor's offices. If they don't have insurance or they have something called charity care where they have no insurance at all, they can also apply for patient assistance programs where it's just a short application. They may have to submit maybe a W-2 form or proof of income, and then through that they can get it through the manufacturer free of charge. So it depends on the medication. For most medications, they have a manufacturer or a patient assistance program. And then people may have also heard of GoodRx or websites like that where they can take kind of like a coupon card to their pharmacy. It has the specific information information like an insurance card would. Of course, that's not insurance. If a patient does have insurance, they can add on to it.
Okay.
But it is something for a patient or prescription assistance for a patient if they need it. So it's kind of like a coupon card. It may not be a catch-all, but it does have discounted prices for our patients who may have trouble affording their medications.
And I think another thing, again, is be your own advocate, right? Ask those questions. Ask if assistance is available. You know, for my patient population, a lot of what we struggle with these patient assistance programs is that many of my patients have Medicare. And a lot of these coupons that you can add on to insurance are prohibited if you have Medicare or Medicaid or any other federal payer. But if you work with the medication company, there is a way to still deploy that patient assistance program, but it can take a few weeks for it to take effect, and there could be more paperwork. So plan ahead, ask questions, ask your pharmacist, ask the doctor on how we can get that assistance, because that assistance is available, even though sometimes it could be a little bit harder to get it.
And what about generic versions of a drug? We know that they're cheaper, but how does somebody ask for the generic? We don't see the ads, we don't know the name. How can someone get the generic, cheaper version?
Sure. So it's actually a rule in the state of New Jersey that if a generic medication exists and it's less expensive than the brand name, and if a prescriber hasn't indicated that the brand name is medically necessary, the pharmacist will substitute and will authorize a generic medication to try to curb costs and keep medication expenses down. Generic medications are FDA approved to be equivalent, to be similar to the brand name product. Now, the brand name product has been branded. It looks a certain way. It has a certain imprint on the tablet. And those are things that belong to the company that really invented or developed that product in the first place. That being said, the generic can't look the same. So it might be a different color. It might be a different shape tablet than the brand name product. But the active ingredient, that is the medication that medication or pill is intended to contain, is the same as that brand name product. Certainly, if patients have questions or are concerned about the way a tablet looks, we always encourage them to speak up and ask their pharmacist. The theme today has really been advocacy and advocating for oneself. So I certainly think if anyone has a question about their medication, if it looks different, if the pill is a different shape, to double check. But that being said, I think generic medications are a great way to save money, to curb costs, and to get the same benefit from what the intended purpose of that medication was in the first place.
And many times pharmacists out in the community, so say, you know, CVS, Walgreens, Walmart, they do have access to your formulary, right? So they can see, okay, so maybe this medication that's branded, there isn't a generic available, but this other medication that is also branded is actually preferred by your insurance, so your copay will be a little bit less. So again, speaking up, you know, asking questions, asking what is the preferred medication on my plan, because sometimes plans actually prefer certain brands over a generic. A generic doesn't always mean that it's cheaper. It really just depends on individual insurance plans. So reading more into what your insurance is, also asking your pharmacist, calling the insurance company, that's going to get you the most direct information of what's cheapest and most beneficial for you.
Thank you. So recently I've heard the term deprescribing used several times. I've read articles about it. What does it mean for a patient deprescribing and their healthcare providers? Can you tell us more about it?
Sure. I can start with that one. Deprescribing is the planned and supervised discontinuation or reduction in dose of a medication. And this is usually done when a medication is no longer needed. So again, the condition that medication was used for is now resolved or no longer a concern, or when a medication might have the potential to cause harm, either due to a side effect or again, just an expected effect of the medication. Perhaps the dose, again, is too high, and that's requiring a reduction. This has been used increasingly. I think it's garnering some attention, and I think it's important for patients, people who are consumers of medications, to be aware of, because it is a strategy to sort of evaluate a medication profile, evaluate a medication list that someone's taking, and determine whether or not a medication is needed. It's a way to take an inventory. It's a way to review your medication list with your prescriber, with your pharmacist, and determine if all those things are still necessary or can be adjusted.
Yeah, I think in the aging population in particular, we prescribe so many
Right.
medications over time, and we forget that over time our bodies are changing, and sometimes our reaction to these medications that once were beneficial might cause us some harm. So what we've been talking about this whole session was really advocating for yourself. So in that same vein, we ask patients to advocate for themselves in terms of deprescribing, because you may be on a medication or you may have found a medication on an ad that you may not even need, or it might not be beneficial for you. So talk to your doctor about it. I think that's the first step. Is if you're in this patient population, you have even 5, 10 plus meds, maybe it's worth reconsidering some of those medications. Do you really need to be on them?
Right.
Are there some drug interactions that you're not aware of? Are there things over the counter that you're taking that could be interacting with this? So that first step is really talking to your provider, having a conversation of, what are these medications for? Am I aware of what they're for? Are they beneficial to me? Or are there some that we can cut out so that I can have a better quality of life?
And it sounds like it's important that every one of your doctors knows the prescription that every other doctor is writing, where the prescription card that you showed there would be very handy to bring to doctor's appointments.
Yes, absolutely. Because sometimes there are cases where not all of your physicians know all of the medications you're taking. You know, if your primary physician is prescribing one thing and then your cardiologist prescribes another thing, maybe, you know, they didn't get a chance to have that phone call to give you an update before your next appointment. So making sure that you're keeping track of who's giving you which medications, always bringing that complete list, and not be surprised if the conversation happens where we're going to start taking away some of your medications. Because I know for the physicians who I work with, a very big mantra of theirs is, if I'm going to add a medication, I'm going to try to take one away, because we want to make sure that we're decreasing pill burden, that we're also containing costs. And sometimes that decision in terms of whether or not we're stopping a medication is because of that time to benefit, which is, you know, more important in our older adults, because if a medication is going to give you a benefit over 15, 20 years, maybe it might be time to take that medication away, depending on what the situation is with you and your doctor.
So more medicine is not always better.
Correct.
And if your physicians pull back or stop a medication, that's not necessarily a bad sign. It could be a good thing to take less.
Correct, because sometimes we end up with more medications because we're treating side effects of other medications that we're on. So if we're able to stop that one medication that's causing side effects, then we're maybe able to pull away 1, 2, or possibly 3 medications, which could be more beneficial for our patients. Yeah.
Very interesting.
I think it all comes down to medication adherence. We know drugs don't work in people who don't take them. So anything that we can do to simplify the medication list, to eliminate, you know, medications where risks might potentially outweigh benefits is really important. And again, I think that's where sharing that med list with all of your providers, from your dentist to your primary care providers, your subspecialists, everyone kind of needs to be familiar and know what your medication profile really consists of. And don't negate those non-prescription medicines. I think Jess made a really important point about non-prescription meds. Just because it is available without a prescription doesn't mean that it's without side effects, doesn't mean that it's without the potential for drug interactions with other prescription medications you might take. I think that's really a critical point that that viewers be aware of.
So when you're talking to your doctor about your prescriptions and your medications, those over-the-counters are an important part to bring up. It's very important to let them know about those.
Absolutely. And also if you're getting any samples from a physician office.
Oh.
Yes, because from a pharmacy perspective, if I'm filling a medication, I'm only able to check interactions of records that I have. A lot of times samples that you get from a physician office do not go through a pharmacy.
Interesting.
So those will never make my list of being able to see what are you on to see if anything's interacting. So if you are getting something that is a sample from a physician office, which is typically those brand name medications that are very expensive, making sure that you're letting your pharmacist know so that they could double check that there are no interactions is very important.
So is it a good idea to take samples, or do you recommend against it? It is a good idea.
I mean, samples, they are FDA approved. It's not that they're just random medications in a physician office. They do come from the drug manufacturers, and they do have to be given to you by a physician under supervision of a physician. So it's as if they gave you a prescription for, say, Myrbetriq, but if Myrbetriq's too expensive for you, the doctor says, okay, I have a sample of it. This is a 14-day supply. I'm going to give this to you in the meantime so we could figure out, say, a patient assistance program.
Okay.
right? It's kind of like a gap. It's not meant to be a long-term solution, but sometimes you can get a short-term supply that's in the actual packaging from the manufacturer that is FDA approved. It's within, the expiration date, because I know at my practice, I do check those because those medications expire too. But making sure that they're, approved, they're in date, they're properly stored, properly packaged, all of that.
So coming up soon is the Medicare open enrollment period. Do you have advice or suggestions for people to make sure they're getting prescription coverage for what they need?
So going along with the theme of today's episode, definitely advocate for yourself, ask those questions, look out for resources. So for example, AARP's website has a really great tool where you can plug in the different medications that you're on, and it'll show you what your costs look like based on certain plans that are available. So what it looks like from a deductible. So a deductible, again, is that unavoidable cost, no matter what medications you get, whether or not they're covered. I feel like lots of patients mistake a deductible for meds not being covered. That's not the case. So what is your deductible like? What is your premium like? What do your copays look like? And what are the different tiers of copays based on the medications that you're on? Also, if there's a coinsurance in play, which not necessarily is a set copay where, $10 is your copay. This is more like, okay, we're going to cover 80%. You need to cover 20% of whatever this medication cost is. So looking at what is the structure of your plan based on deductible, coinsurance, copay, what does that look like? What are going to be your overall costs for the year? Looking at those things to decide which plan is best for you. Also knowing that you're not automatically enrolled in a prescription coverage plan. I've definitely had some patients, yes, where they enroll in Medicare and they're not automatically enrolled in a prescription plan.
Okay.
So that you have to make sure that you actively enroll in, because that's not done for you.
That's a really good point.
Yeah.
And there are several programs in New Jersey for prescription assistance, which can be found on our website at njaaw.org under resources, where there are programs within the state to help people who can't afford their prescriptions or who don't have insurance. So can you tell us a little bit, Jess, about the situation where someone's in the hospital and when they're discharged, how are they going to get the prescriptions and the medication that they need?
Yeah, that's a great question. And sometimes the answer isn't always direct.
Okay.
So the way that the process should work, or a care transition, which happens, is when a patient moves from the hospital, say, to home.
Okay.
Many times prescriptions are hard prescriptions. They're written from the physician and given to you if you're the patient when you're leaving the hospital, along with your discharge papers. So if that's the case, then you need to bring that prescription to your pharmacy, have it filled, and go home. There's certain hospitals, like I know my hospital, we have a pharmacy in the building where you can have the prescription filled and delivered to you bedside so that you have it and you don't have to make that stop.
Okay.
Lots of hospitals have that now to help ease that transition. So asking your nurse about if there's a what we call meds to beds program or a pharmacy in the building to have prescriptions filled, asking about that ahead of time before discharge is actually really helpful to save you a stop. So that's kind of tip number one. Tip number two is then figuring out what are the medications that you're supposed to be on when you leave? Because many times we change medications for you when you're in the hospital, whether we add new prescriptions or we actually take some away because, say, the medication was what caused you to be in the hospital.
Okay.
So making sure that you're speaking to your physician before you leave and your nurse to make sure that you know what you're supposed to be taking. And that's, updating your medication list, making sure that you have a new list before you leave so you know your plan. Also, when you get home, making sure if you have a pre-filled pill box, going through it and basically redoing your pill box, especially if you have some meds that were stopped. Because many times I used to do home visits, I would go back to a patient's home and they would have a prescription that would have double the amount of pills because they would just put in the new medications that they were given and didn't go through the old medications. So that can definitely increase your risk for having an adverse drug reaction or an adverse drug event if you don't go through that. And then finally, what can happen is when you follow up with your physician, you should be seen by a physician or at least contacting their office within 2 weeks of discharge to make sure that you can have a follow-up visit. So during that time, going over again, what is your plan? What medications should you be on? What medications should you have stopped in the meantime? So again, advocating, updating your list, asking the physician, asking their office, what is your plan to make sure that you're on the right regimen and that you're not coming back to the hospital because of a medication-related event.
And then what about going the other way? If you have a planned hospitalization, like a planned surgery, do you bring your medications with you or does the hospital provide it for you? How do you handle that?
So for us and most hospitals, the medications are provided for you.
Okay.
There are certain times where we may not carry the specific medication that you have because each hospital, it runs by a formulary, which is a set list of medications. Many times what we call an auto sub or an auto substitution, we're switching meds that are in the same class. So in terms of the therapeutic effect, it really is no difference between switching between what you're on at home versus say what we have. However, if there is a point where you're on a medication that we do not carry and cannot be changed, we will ask you to bring it from home. And the pharmacy can verify it. You can be given it while you're in the hospital, and then we send you back with that medication bottle. But for the most part, we do recommend that you do not bring medications to the hospital because we want to make sure that you're not losing them.
Okay.
And also, too, that you're not taking them in addition to what we're giving you.
Right.
Right? So making sure, again, bringing your medication list, letting your nurse know what you're taking, letting your physician know what you're taking so that that's documented and that we're able to continue everything that you were on at home prior to the hospital while you're there, unless if something needs to be changed based on your current clinical picture.
Thank you. That's really good advice. So I want to thank the three of you for being here today. This was a lot of information that we covered. And I want to thank all of you for watching this episode of Aging Insights. To find out more information and to view previous episodes, please visit our website at njaaw.org and click on Aging Insights. Aging Insights is brought to you with the support of our funders, supporters, and viewers like you. And I want to thank our partners here at PCTV for helping us bring our guests to you today. If you need information or resources about services in your area, please contact your County Office on Aging. Their phone number can be found on our website, or you can dial the state hotline at 877-222-3737. New Jersey Advocates for Aging Well wants to remind you to stay safe during the pandemic, and please reach out to older adults who may be isolated, lonely, or in need of assistance. Thank you, and be sure to tune in next time.